All right, so we're going to talk about airway clearance, and I'm pretty sure most of everyone here has some form of airway clearance device at home, and if not, is pretty interested in what is out there. And hopefully you've had the opportunity to see some of the equipment that I've had lined up outside, and I've had some materials, so you can also go online to get some information. Let me grab this real quick. So I've just included some things that many of us may or may not have as far as triggers that cause a little shortness of breath or maybe a little bit of inflammation or phlegm. So I just kind of added this little cycle for you. So whenever we talk to patients in our clinic, in the adult day unit, when we have time to sit down, which we do spend plenty of time with our patients and give them quite a bit of education on how to use airway clearance. One of the things that we stress is the pulmonary hygiene. And of course, that's also a big thing with our physicians when our patients come in, to make sure we start with airway clearance education right off the bat. And so I'm just going to give you a little bit of bullet points and show you what kind of devices are out there and how to obtain them and if there's any roadblocks and so forth. Some of the foundations for therapy would be your non-tuberculous mycobacterium, bronchiectasis, cystic fibrosis, and asthma. There's a lot of questions out there on how I get my devices. Is my primary care, can he order it? And he absolutely can. I think one of the big things behind if you're obtaining an airway clearance device outside of National Jewish, because I know how our education process works and how we spend a lot of time to make sure your technique is good. Just make sure that you get proper education if you obtain a device outside of National Jewish, because that's key. If your therapy is good, if your technique is good, then the device is gonna work. So that's, I just wanna stress that. We get a lot of patients that come in and they do have a device and we have to re-instruct them, and that could be very, it's time consuming and frustrating for the patients, so. So non-invasive forms of therapy to help mobilize and clear mucus from the airways. You have your PEP devices, your positive expiratory pressure. You have your oscillating positive expiratory pressure, which is going to be your Aerobica. There's also the Acapella out there. I know that I've spoken with a few of you who do have an Acapella at home. If that's the device you're using, again, just make sure you get education on how to use it and have proper technique. If you have a blue Acapella, that's generally for pediatric patients or low lung volumes. I'm just letting you know that there's also a green Acapella, and this is for patients that are currently utilizing that device. We here at National Jewish, we use the Aerobica. We like the device because it is one that you can care for easily. You can clean, you can sterilize, and we're really comfortable with the sterilization process. Once you have the Aerobica, you feel like it's not actually doing everything that it needs to do, or you feel like you have deeper airway consolidation. The doctors will also order a high frequency vest. I had 3 devices out there, including one that was portable. And again, hopefully you had the opportunity to look at those devices that were sitting out there. Recently, back in 2020, just after the pandemic, the Valera was introduced to our regimen, which is also part of the airway clearance device solution. You will get a little bit of controversy on that, but it is a good device. I kind of like it. And then, of course, you have your chest physical therapy or physiotherapy, which you can also do manual therapy with palm cups and have somebody do it for you if you don't have the Aerobica or the vest. So the need for airway clearance obviously is to help with movement and removal of secretions if done properly. We do know that the cilia is part of our just built-in mobilization, and sometimes that fails to operate properly, or sometimes with mucus impaction, it does tend to hold that process back. So we do have out there mechanical devices that will help you with this. So here are some of the devices that are out there that are available. Is the Aerobica, the oscillating positive expiratory pressure. This is the device that we are using here at National Jewish, but I'm not going to turn anybody away who has another device, such as the Acapella. I will always give instruction on proper usage and how it works best. This is powered by the patients using their exhaled breath. Just keep in mind that some of us like to blow hard, you know, the more the better, and a lot of times it's not necessarily that's true. You might have more of an adverse effect if that's the case. So proper technique, and this device works great. The resistance is what on this device, the Aerobica, if you notice just below where the mouthpiece is, you'll notice there's a little lever there that has a series of numbers, which is the amount of resistance 1 through 5. And just you can just kind of adjust it to what works best for you, and you're not having to use too much effort to exhale. It can also be used in line with a nebulizer, and we'll go ahead and talk about that in just a few. I think I went ahead and spoke quite a bit on the Acapella and just what to look for if you are currently using that device. Your inhaled saline nebs, you can also use the nebulizer with a bronchodilator if that is indicated with, you know, with reactive airway disease, or if your physician has that prescribed. But this is really nice. The patients, they're prescribed an Aerobica, and we do ask our patients to use it for at least 10-15 minutes each time. It's it could be very time consuming, where we end up not even using it at all. And, you know, I've run across quite a few patients who, you know, they have the device, but it just kind of sits there because it's just too much. The physicians may also order the bronchodilator or hypertonic saline if we have nice, thick, sticky mucus, or we have mucus that we like to kind of thin out and, you know, help the Aerobica move that mucus just a little bit easier. So this is a way that helps the patient not only have the advantage of using the Aerobica and getting the use of it, the proper use of it, and also getting their inhaled medication in at the same time. The bronchodilator is generally first, if that's what's prescribed, followed by your hypertonic saline. So as far as cleaning the Aerobica, keep in mind that this is a single patient use. We ask that our patients wash it at the end of every day in warm soapy water. You can actually get that water as warm as you can, to where it's not on that, you know, the boiling degrees, but at the end of the day. If you're not using it during the day, just because I don't want it enclosed after the first time use, just open it up and just let it air dry until you use it for the second treatment. And then after that, you can go ahead and wash it in your warm soapy so it can dry overnight. You can also disinfect, and there's 4 methods out there that have been approved for that. As far as the Aerobica goes, is boiling 5 to 10 minutes. I know there's a lot of talk about, you know, what you're telling us 5 minutes, but it's 10 minutes out there. There's a lot of support groups out there, you know, and definitely you can boil it for 10 minutes. There was that case study with the Monaghan manufacturer that 5 minutes was good, but you know, we definitely want our patients to do what's best for them. So 5 to 10 minutes for boiling. You could do the microwave steam bag for your Aerobica. The Aerobica or any other device that goes into a microwave, just please be careful. It's, we have had quite a few patients tell us that their microwave have melted their devices just because of the variability in the power. You can also soak in alcohol and peroxide. Those are used just once as far as the solution, and then you have to discard. Fresh each week. You can sterilize every day, every other day. You can sterilize up to once a week if we're just kind of maintaining that cleanliness. If you see if there's an active infection, I would highly recommend that you sterilize daily with that, okay? And then I gave a little bit of information on the Acapella, what we recommend for cleaning and sterilization on that one. So as far as the reusable breath actuated nebulizer, which is going to be your Aero Eclipse XL, and that XL is going to be the key for identifying the reusable. Those reusable cups are good for 6 months. You do wash those, and you can also sterilize those the same as you do your Acapella or your Aerobica. And that's going to be boiling for 5 to 10 minutes. You want to replace that after 6 months. Make sure that you do wash it after each use and let it air dry before you use it again. If you're using it with any other medications, such as this particular one, I do like, because all the other nebulizer cups that we used out there, as far as the Pari brands we used for years, which are great. I don't have anything bad to say about those, but there were a lot of different Pari nebs that were to be used with certain medications, such as antibiotics and salines and albuterols. And the patients would leave our department with a bag full of neb cups to take home. And then it got confusing once they got home. So your Aero Eclipse is approved, is FDA approved for all these medications that are out there, such as your bronchodilators, your salines, your inhaled antibiotics, as far as your amikacins, your tobramycins, your colistins. Just keep in mind that if you are going to use the same nebulizer cup throughout that process, to rinse it, to wash it between each use, okay? So we do have a compressor out there. I don't want to tell anybody that they have to get this Umbra compressor. As far as a full disclosure, I am not part of the Monaghan. I'm not part of their company. I'm not benefiting from this, but I do know that this Umbra compressor is a higher PSI. So it is a higher pressure. It's the highest one that I feel like the patients feel like they get a better treatment, because the ones that we use in the hospital are on the wall. Those are your 50 PSI. So this one runs right around 40. Some of your standard compressors out there that you get from your Walgreens or any type of pharmacies or medical device stores, those are pretty standard. Your insurance company will pay for those, but they're very low in their pressure, their PSI. So that's the thing. Your insurance company will not pay for something such as the Umbra. They call it a specialty item, so you'll have to pay out of pocket, because it does run so high as far as the pressure. So that would be an out-of-pocket expense, but just know that it's very good. And plus your treatments go a lot faster than running with a pretty standard one. So here we go. So once you're with your Aerobica, if your physician feels like they want you to have a little bit more aggressive therapy, then they'll go ahead and order the vest, your high frequency chest wall oscillation. Someone came up to me today and said, well, the Aerobica works for me. I don't think I need to use my vest. Can I go ahead and donate it or give it away? It's like, no, I truly recommend that you keep it, use it. Your doctor recommended it for a reason. The Acapella does work, or the Aerobica does work. It does get to those areas. And patients that are in that mild kind of stage of their bronchiectasis. The doctors want that airway clearance. They'll do the aerobic at home. The vest isn't necessary, but that if the physician orders that vest, there's pretty much a reason why. So I would highly recommend that you use it. So there are two types of high frequency units. You have your machine powered, which is your Hillrom, which is the vest, Respirotech and Courage, and Electromed Smart Vest. Those are the three companies out there. They're their own entity. They are not considered as far as the DME, such as Apria, Lincare. Those are your DME companies that are sitting over here that supply you with oxygen and so forth. Hillrom, Respirotech, and Electromed are their own companies, so they have a very good reputation, and their customer service is great. Your battery powered, which is going to be your portables, are your Monarchs and your Aflo. Those run off of batteries. They're good. They don't work as well as some of these machine powered ones, the air percussors. So, but that's only, you know, if once you return back for follow-ups and the doctors look at your reports, then they'll be able to tell you whether it's working or not. So I went ahead and just as I just said, I just placed on there the best is through Hillrom, Encourage, Respirotech, and so forth. So here's some pictures of some of your devices out there that are available. This one is the vest. And then we have the Encourage. All of these units that I'm showing right now, they can be washed. As far as the garments, you can wash these in the with a regular wash. Some of them have bladders, some don't, but patients like the fact that, you know, they can be cleaned. And then here are your portable units. You have the Monarch, kind of space-like looking, isn't it? They're very heavy. I just want to let you know that. We have some patients that love them. It's kind of that, you know, I can walk around with it. I can do other things while I'm getting my vest therapy. But if you're doing nebulizers, then you're kind of sitting there anyway. So, and these are about 12 to 15 pounds. The Aflo, the same. They run off of a battery, so you get more of a vibration out of these. And then the Valera that I had spoke about earlier, I did give the 3-in-1. So you have your continuous positive expiratory pressure, your continuous high flow oscillation, and then of course there's a nebulizer attached. So you can get all those therapies all in one. Again, this, you know, there's a little bit of controversy on, you know, how well it works, or you got to be very careful on patients, certain patients and their lung condition on using this. So your physician will, you know, he's the expert or they're the expert. They'll be able to tell you whether this is a good device for you or not. Insurance wise, very hard to get covered. So, and that's another thing. It is recognized through insurance companies for neuromuscular disease and not bronchiectasis. So the benefit of proper pulmonary hygiene, it enhances your mobilization and removal, decreases lung infections, recurrent lung infections, at times antibiotic use, hospitalization. You'll notice that a lot of times if we have that chronic cough, that continuous dry cough, it does help with that once we start cleaning out those airways. Of course, the gas exchange and improves quality of life. And that would be it. Thank you so much.